Ed, and welcome back. We're going to cover episode 2 of Anatomy of a Startup with Mila Health CEO Shailu Verma. Shailu, episode 1, we talked about your career, basically the things that you've been doing a lot in corporate America, although you did have a background in having a previous startup that was successfully spun. And we talked about how this all came about in your thought processes and how these previous positions prepared you for Mila Health. So tell us about the name of Mila Health. And then I want to cover what is Mila Health? What's the problem that it's solving? And then I want to talk about some of the key steps you had to make next in terms of developing a team and backers.
Absolutely. So we were looking for a name which is universal, a name that is empathetic, that is engaging, that has the human-like qualities that we would expect out of an assistant that is taking care of a loved one. And so we did a bunch of, searching around and we wanted a name to be simple as well. And so Mila came up as one of the names that, was simple and has many of those qualities. And it has very pleasant meanings across different languages, Slavic in particular. And so we said, okay, we go with that name. And that's how Mila Health came around.
And that's a good point too. Like, you don't want to just do a lookup in English or a second language. You got to do a lookup in a lot of languages because you never know, right? There's all these famous stories of people coming up with great names or hand gestures that might mean something peaceful in one language, but in another culture, it means something completely different. So that's good wisdom right there. So obviously it's high tech given your background and the age that we're in, and you're leveraging AI. Tell us, what problem is Mila solving?
Yeah, thank you. And so what we set out to do with Mila is solve a very broad problem space. So specifically, there's around 24 to 36% of patients that fail to follow up with a care plan. What I mean by a care plan is it could be in the context of chronic care management around type 2 diabetes, congestive heart failure, or it could be preparing for a procedure like colonoscopy, or it could be taking care of gaps in care around vaccinations, around screening at the right time, annual wellness visit, etc. So patients fail to keep track of reporting their symptoms, managing their diets, keeping up with their appointments. And when they skip these appointments, particularly in the context of chronic care, it certainly comes as a cost to their health, but it also comes at the cost to the overall health system and revenue for the physicians in the fee-for-service context, as well as in value-based care context where they're tracking quality metrics in their MSSP program, for example. Now, to engage with the patients, most of Mila customers, all the provider systems that we speak to, the payer systems that we speak to, the ACOs that we speak to, all rely on a legion of nurses or clinicians to call a patient saying, hey, Shailu, you're preparing for a colonoscopy. Do you know you need to have a low-fiber diet 5 days before your procedure? Do you have a ride before the procedure? You need to get on a liquid diet. These are your requirements. All of this happens with the phone call today. I have to track my blood pressure for my congestive heart failure conditions. That is a phone call. This is super, super expensive. It causes a ton of burnout. And so we essentially decided that this is a solution that we can enable through large language models and through a knowledge graph, where Mila completely autonomously either texts or reaches out to a patient in any language of their choice, understands the context of what needs to be achieved, where the patient is in their care journey, have the conversation with the patient, address questions that they have, and complete the outcome. And the outcome could be as simple as, can I set up an annual wellness visit for you? Or it could be slightly more complicated as saying, well, you've got a colonoscopy 10 days from now. I'm going to walk you through the process. I'm going to remind you what you need to get done. You can ask me any questions that you need to, and I'll address and walk you through this journey to make sure that you're adequately prepared for that procedure. So that is the essence of what Mila does. And the problem that Mila solves is essentially be that assistant for the patient, which a doctor initiates and ensures that we increase the adherence to their care plan. That is the core problem.
Yeah. And it makes a ton of sense as you explain it. And certainly I think listeners will be like, oh, how do I get that? Because that would solve a lot of issues. I can see how that will definitely be music to many people's ears because that's a common challenge for hospitals as well as provider offices. And frankly, for me as a patient, I prefer having an automated tool to deal with because then it's much simpler than a traditional phone call or something like that. So I think in the next episode, we'll talk about in episode 3, building out the team and the backing that you need. And then in episode 4, just as a teaser, we will talk about results. So by this time, you'll have real time results to report. So, Shailu, thank you for sharing the story on the anatomy of startup.
It is my pleasure. Thank you, Ed.